Hello, my name is Yvonne Lagarde. I am the chairperson of the Pelham, New Hampshire Council on Aging, and today my role is to present Managing Diabetes, Turning Food into Energy Session 2. So, as before, we're going to talk about how you can manage your own diabetes, or if you're a care provider, how you can assist somebody to manage their own diabetes. As you know, I'm not a doctor or a healthcare professional, so the information I'm sharing with you today is general information. For specific questions related to your diabetes, be sure and speak with your healthcare provider. So what are we going to talk about today? We're going to get a lot more into planning meals, how to count carbohydrates. We're going to talk about managing physical activity, managing stress, emotions, and have a nice chicken curry salad virtually. We'll talk about positive thinking. How do you manage sick days if you have diabetes, medications, and finally, preventing complications of diabetes. So let's talk about planning meals. When you have diabetes type 2, planning meals can sound really complicated. You can feel like you're on this tightrope of not knowing what you should or shouldn't eat. So here's a very simple tip. This is called the plate method. So you want to think of dividing your plate into quarters. And half of the plate should be non-starchy vegetables like spinach, broccoli, or fruit. So you can see here, half the plate is fruit and non-starchy vegetables. A quarter of the plate is going to be protein, your lean protein, fish, meat, chicken, beans, things like that. And the last quarter of the plate can be starch, like anything made out of grain, rice, potatoes, corn, those kinds of things. So if you could eat like that, you will not spike your blood sugar levels. Okay, so here's an example of an excellent meal for a person with diabetes. This will not spike your blood sugar. So half the plate in this case is vegetables with mushrooms and some green beans. Quarter of the plate is some grilled chicken. And then the other quarter is some grilled corn. So that meal will not spike your blood sugar. And that's your goal when you're a diabetic, is you don't want to you don't want to have your blood sugar go up really high, because that's when you're going to start to have other health problems. Another suggestion, smaller portions. As a diabetic, you want to have small portions of food. The smaller the portion, the less it's going to spike your blood sugar. So it's more important for a diabetic to have small meals more frequently than to have large meals. And a portion is smaller than you think. For example, a portion for rice or pasta is 15 grams. That's about a third of a cup. So a portion is typically the size of your palm, all right? Okay. Now, does that mean you can't have more than one portion? No. It means you've got to keep your total grams of carbohydrates in each meal between 45 and 60 grams. If you can control your carbohydrates within that range, you again will not spike your blood sugar. So here's some examples of 50 grams of carbohydrates: 3 slices of bread, a plate of pasta, 3 small potatoes, and a couple of half cups of rice. Okay, so the question becomes then, if you know you want to keep your carbs between 45 and 60 carbs per meal, how do you count carbs? So you can see here in this picture, the piece of toast is 15 carbs, peanut butter is 4, eggs doesn't have any carbs in it, it's protein, and the fruit had 15 carbs, and then a glass of milk had 12 carbs. How did we know how many carbs was in that food? Easiest thing you can do is buy a book. I have several carb books. If you're watching this and you'd like one, just let Sarah know and I'll bring it into the Senior Center for you. But carb books, and you can get them from a bookstore for $5, $6, something like that, list all foods in the book. And then it tells you how many carbohydrates are in those foods, in one portion of the food. So again, the important thing to remember is for each meal, no more than 45 to 60 grams of carbohydrate in the meal. So let's talk about a popular meal, chicken parmesan dinner with broccoli and linguine. So the first thing you would do is get your little carb book out and look up how many carbs are in 1 cup of broccoli. And you're going to find out it's 4. Then you're going to say, okay, there's cheese, right, in your chicken parmesan, about 4 teaspoons in 1 serving. How many carbs are in that? 5. How many carbs are in 4 ounces of chicken breasts that's been batter dipped and fried? Just over 26. And here's the big one. How many carbs in 4 ounces of linguine? 84. Anything that's processed, and linguine is processed food, right? You buy it in a package, is going to be higher in carbs. So if you add all these up, how many carbs did this person eat? 119.2 carbs in their chicken parmesan with broccoli and linguine. So that's too many, right? So what are you going to do to reduce down your carbs? Well, this person had 4 ounces of linguine. If they only had 2 ounces of linguine, they would cut their carbs in half to 42. And that would probably get you to where you need to be. You can also see with the chicken breasts, they had it batter dipped. Now batter is going to be high in carbs. So if they didn't batter dip it, and maybe they just grilled it, you're going to cut down those carbs also. So that's an example of how you count carbs. Now, if you decide that if you have a smartphone, you can Google it. You can say, okay, Google, how many carbs are in 2 slices of toast with butter and jelly on it? And it will tell you. So that's another easy way to find out how many carbs are in food. Obviously, if you have a computer, you can also go online and check how many carbs are in food. So it's generally better as a diabetic to eat smaller meals every 4 to 5 hours during the day. Why? Smaller the meal, the less sugar, less glucose you're putting into your bloodstream. And it helps you control the release of sugar into your bloodstream. There is one meal as a diabetic you should not skip, and that's breakfast. Because think about it. You've been sleeping all night, 8 hours, or however long you sleep, haven't been eating. So you're basically fasting. So that means while you're sleeping, your body still uses sugar in the bloodstream. When you get up in the morning, you probably don't have any glucose in your bloodstream. Remember, glucose, sugar, is the fuel of the body. We need sugar in order to function, in order for our brain to function. So when you get up in the morning, you probably are going to have lower levels of sugar. So it's important that you eat breakfast so that your body's going to convert that to blood sugar, so you have sugar in your bloodstream to start the day. Let's talk about physical activity. Some people, when they learn that they're a diabetic type 2, get scared to physically exercise. And really and truly, if you're a diabetic, it's important to get exercise, mild to moderate exercise. Why? When you exercise, you're using sugar in your bloodstream, right? And that means your body doesn't need insulin. Remember, insulin's job is to take sugar out of the bloodstream. Well, when you exercise, exercise is doing the job of insulin. Your muscles are using the sugar in your blood, so you don't need to release insulin. So exercise helps you control your blood sugar levels. How much exercise should you have? At least 150 minutes per week of some kind of aerobic exercise, at least. And what you want to do when you're a diabetic is check your blood sugar before you exercise. If your blood sugar's low, do you want to exercise? No, because you don't want to get hypoglycemic and pass out or something like that. So if your blood sugar is low before you exercise, you're going to need to eat a little bit of carbohydrate. All right. And then you're going to do your exercise, whatever it is. And then afterwards, you want to check your blood sugar again. If it's low, again, you might want to have some juice or something like that. So it's really recommended, if you're a diabetic type 2, to have mild to moderate aerobic exercise for at least 30 minutes a day. That is safe, and it's an effective way to help control diabetes and stay healthy. Again, remember to check your blood sugars before and after exercise. Other exercise that's really helpful for you is strength training and doing some stretching. So those are things that are really beneficial to you if you are a diabetic. So other points to keep in mind. If your diabetes is not well controlled, in other words, if your sugar levels go up and go down, they're not stable, don't start an exercise program. You want to make sure that your diabetes is well managed, and then you can start an exercise program. If your diabetes is out of control, obviously you should be working with your doctor, who's going to be maybe changing your medication or talking to you about your diet to try to get your diabetes under control. You have to learn when you're exercising to coordinate eating, medication, so that those with your exercise. So you want to make sure before you exercise, typically an hour before, you've had something to eat. You want to control when you take your medications. So that's the reason why it's important to check your blood sugar levels before and after you exercise. If you are not taking insulin, you should plan to be active about an hour after eating meals or snacks, and that will prevent low blood sugar. If you have type 1 diabetes, which means you're taking insulin, and if your blood sugar is less than 100 milligrams per deciliter before exercising, absolutely you need to eat some carbohydrate. Again, one portion size, the size of your palm, will get you 15 to 30 grams of carbs, and that will help rise your blood sugar ups before exercise. When should you stop exercising? As a diabetic, you need to be very cautious. If you feel dizzy, you have shortness of breath, you feel sick to your stomach, you're in pain, don't push through it as a diabetic. Stop exercising immediately. That is very, very important. So you need to be aware of how you're feeling when you exercise, when you're diabetic. Any of those symptoms, you stop. Check your blood sugars. You might need to eat something, but you stop. Also, as a diabetic, it is really important that you don't get dehydrated. So what you want to do is before you exercise, make sure that you've had 8 ounces of fluid, a good glass of fluid. Take fluid with you. If you're going to go walk or something, have a sip every 15 minutes or so. And then when you stop exercising, again, have another 8 ounces of fluid. Many diabetics don't exercise because it's uncomfortable, because they have problems with their feet, with sensation in their feet, or they have poor blood circulation. So you want to be sure you're checking your feet regularly. You want to protect yourself from any blisters or abrasions. You want to have good skin and nail hygiene care. I recommend, if you're a diabetic type 2, that you have a podiatrist or a nurse cut your nails. You don't want to get any kind of little abrasions, or you don't want to nick your skin. You don't want to have ingrowing toenails, things like that. So, you know, here at Hobbs, they have a podiatry clinic, and I would definitely recommend that you go to that clinic. If you're trying to exercise, to walk, or whatever you're doing, and your feet are uncomfortable, you might want to consider shoe inserts, and you want to get the inserts that can be tailored to help protect the soles of your feet. So those would be heat moldable, diabetic shoe inserts. And those inserts are molded to your feet, and that's going to be a lot more comfortable. Let's talk about managing stress and emotions. If you've recently learned that you have diabetes, or if you have diabetes-related complications, you can, obviously, it's scary. You can be scared, you can be angry, why me? And you can get depressed. All of these feelings are normal. They're understandable, and they're also manageable. And you need to be aware of how you're feeling, and you need to manage it. Why? For people with diabetes, stress and emotions like anger, fear, frustration, and depression will raise your blood sugar levels. So for this reason, it's really important to learn effective ways, self-management, to deal with your feelings. If you hide your feelings or you ignore them, you're going to get sicker. So we're going to talk about relaxation techniques. Relaxation has to do with your brain. The goal of relaxation is to turn off the outside world so that your mind and your body are at rest. And this reduces, or it eliminates, tension from both your body and your mind, and it will result in improved sleep. It will reduce stress, pain, and shortness of breath. One of the easiest relaxation techniques is called a body scan. And when I do this class in person, I actually do a body scan with you. But let me kind of try to explain what a body scan is. So to relax your muscles, you need to know how to scan your body and recognize where you're tense. Are you tense in the back of your neck? Are you tense in your lower back? Once you know where you're tense, then you can release that tension, and a body scan allows you to do this. So typically what you do is you sit quietly in a comfortable position. You can sit, or you can lie. If you can lie in a bed, or just lie on a couch or on the floor. And the first thing you want to do is you want to pick a word, or you want to look at an object that gives you a pleasant feeling. Like you might look at a painting you have on the wall, or a picture of your grandchildren. If you don't do that, the other thing you can do is just pick some kind of word, like one, that really doesn't mean anything to you. And what you're going to do is close your eyes, and you're going to try to relax all your muscles, starting at your feet. So you're going to actually close your eyes. You're going to think about your feet. Think about the blood rushing through the veins in your feet, and you're going to move your way up to your calf and your knee, and you're going to really try to think about relaxing. And as you do it, you breathe in through your nose. So you inhale, and then you exhale through your mouth. And in order to stop your brain from thinking, you repeat that word to yourself. Like for me, it might be one. So I'm thinking about my feet, moving my ways up to my calves, and all of a sudden my brain is doing a grocery list, and I go, one, one. And I'm trying to relax that brain and get that brain to empty all the thoughts from its mind. I'm just concentrating on that one word or symbol. And you do this maybe 10, 20 minutes, and you go all the way up your body. And when you're finished, you just sit quietly for a few moments with your eyes closed. Now, the first time you do this, you might feel silly or stupid. I kind of felt a little odd the first time I did it. And a good way to do it is if you have Alexa, you can say, Alexa, I'd like to hear a body scan. You can Google a body scan, and somebody will sit there and say, close your eyes, feel your feet, move your way up through your body, and that way you don't have to do it silently by yourself. But it is a good way to practice relaxing. Relaxation, like everything, takes practice. And when you're doing it, if you start to have these distracting thoughts in your head, try to ignore them by not focusing on them and return to repeating that word that you chose. And this is something you want to try to practice once or twice a day. And as I said, when I do this class in person, I actually do a body scan with you. Another important practice is the power of positive thinking. You can't live a positive life with a negative mind. All of us talk to ourselves all the time in our head, right? So for example, when I get up in the morning, sometimes I think, I really don't want to get out of bed. I'm tired. I don't want to go to the gym today. I don't want to go to work today. That's self-talk, all right? What we think or say to ourselves is called self-talk. Positive self-talk, positive thinking is good for the brain. So self-talk can be a very important self-management tool when it's positive thinking. But remember, we are what we think we are. Self-talk becomes a weapon that hurts us or defeats us when it's habitually negative thinking. So self-talk comes in many forms, but unfortunately, for most of us, when we self-talk, it's negative thinking. Negative statements are usually in the form of phrases like, I just can't do this. If only I could. If only I didn't. I just don't have enough energy. And here's my mother's favorite. How could I be so stupid? Every time she drops something. How could I be so stupid? This is negative self-talk, and it represents the doubts and fears we have about ourselves and about our abilities to deal with our condition and symptoms. It damages our self-esteem, attitude. It makes us in a negative mood. So negative self-talk makes us feel bad, and it's going to make your symptoms worse. And it can get really bad, so you feel like you're sitting on the edge of a cliff in your head. You've got to change your thoughts. You'll change your world. Norman Vincent Peale is the one who said that. So we can learn healthier ways to think about ourselves so that our self-talk can work for us, can make us feel better instead of making us feel negative. So what you have to do is change your negative, self-defeating statements to positive ones. And that will help you manage your symptoms better. And this change, like any habit, requires practice. So, how do you start learning to be a positive thinker? First, you have to listen to what you're saying in your head. If you find yourself feeling anxious, depressed, angry, try to identify some of the thoughts you were having just before these feelings started. If you can, write those negative thoughts down. Your next step is to say to yourself, okay, that's a negative thought. How can I turn it around? For example, this is something that my mom has says a lot. I can't do the things I like anymore. Why bother? I mean, she kind of stopped walking because she has to use a walker now. And, she said to me, I can't walk anymore, Yvonne. I've got this big walker. And what I'm trying to say to her is, Mom, maybe you can't do everything you used to do, but let's look at all the things that you can do. And we actually got her out by her condo with her walker, and she's 90 and she's starting to walk again. But she had convinced herself, because of her failing health, that she couldn't do this anymore. And we had to talk about not talking about what you can't do, but what can you do? And there's a lot you can do. So you have to read and rehearse these positive statements mentally or with another person. You've got to start with, I can, I will. I can, I will. It is this conscious repetition or memorization of positive self-talk that will help replace those old habitual negative statements. So the positivity pledge is what I have on her refrigerator and my refrigerator. And I always remind myself of this. I shall no longer allow negative thoughts or feelings to drain me of my energy. Instead, I will focus on all the good that is in my life. I will think it, feel it, and speak it. By doing so, I will send out vibes of positive energy into the world, and I shall be grateful for all the wonderful things it will attract to my life. And I guarantee you, if you learn to be a more positive thinker, other people will be smiling at you. They're going to respond positively to you. It's going to reflect right back on you like a mirror. If you'd like a copy of the Positivity Pledge, you can let Sarah know and she'll email you a copy. Let's talk about other ways to manage the difficult emotions that one has when you get diagnosed with a chronic disease. So one thing to do is don't keep those emotions to yourself. Call a friend, talk to somebody about how you're feeling. For some people, prayer or meditation works. For sure, don't isolate yourself. Get out or away from the house, socialize. I know that's tough in this pandemic time, but even if you just go to the post office, just get out. Don't sit and wallow in all these emotions in isolation. Do something nice for yourself. Get your hair done, get a massage, eat ice cream, whatever it is, something that you enjoy. Try to write your feelings down. When you write them down, you get them out. Always, it makes you feel good if you help someone else or you do volunteer work. That's why I volunteer. When I volunteer, I'm not volunteering to be nice to other people. I'm volunteering because you know why? It makes me feel good about me. Writing down or positive things in your life or what you're grateful for, a gratitude journal is a really good thing to do. I have my mom every day. She has a journal. She writes one good thing that happened during the course of the day. Then when she gets up in the morning, she reads it. And it starts her off in a positive way. And every day she does this. As you know, physical activity or exercise is a really good way to help you deal with negative emotions. When you exercise, your body releases endorphins that make you feel good. If all these things that I've talked about don't make you feel better, and you're feeling like you are depressed and angry and frustrated, and it's going on for several weeks, that's going to harm you. So it's very, very important that you recognize this and you call your healthcare provider. Sometimes depression will need professional help, maybe counseling, also medication. And I'm not talking forever, but just to get you over that hump of all these negative feelings. So do talk to your doctor. We need to talk about managing sick days, infections like the flu, and other illnesses if you're a diabetic. When you get an infection, a cold, the flu, what happens if you're diabetic? Your blood sugar goes up and it gets very hard to bring it down. The way that your body uses food and the way your body responds to your diabetes medications will change when you get sick. For this reason, it's really important to plan for sick days and to know what to do and when to seek help. Number one, plan ahead. You want to have both plenty of sweet and unsweet water, drinks available to you. Okay, so have them in storage. Keep them in your car if you're, drive around a lot, or keep them in your pocketbook, sweet and unsweetened. You need to identify a family member or a friend to help you when needed. So that person needs to know that you have diabetes type 2 and needs to know what to do when you need help. You should have a thermometer at home and should know how to use it. You want to make sure that you have your emergency medical information handy by your phones, in your pocketbook, in your car. And you should also talk to your healthcare provider and ask your provider what are the conditions under which I should call you. When you get sick, you're going to need to check your blood sugar 2 to 4 times a day. So check it when you get up, check it a couple hours later. So check it regularly when you're sick. Keep on taking your medication. Now, the only time you would stop taking your medication is if you're vomiting, all right? If your blood sugar is over 300 milligrams per deciliter, increase testing of your blood sugar, record the results. You've got to watch for symptoms of hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. When you get sick, it can go in either direction. Keep hydrated. 8 ounces, 1 cup of fluid every hour while you're awake. Check your temperature twice a day. You want to try to keep eating even though you may not feel like it, just small portions. When should you call your doctor? If your blood sugar is less than 60 milligrams per deciliter 2 times in one day, call your doctor. If your blood sugar is over 300 milligrams per deciliter for 8 hours, call your doctor. If your temperature rises over 101 degrees, call your doctor. And if you've been vomiting or had diarrhea for 24 hours, call your doctor. When should you call 911? If your blood sugar is over 500 milligrams per deciliter, call 911. All right, hopefully you'll never have to do that. Let's talk about medications. As a diabetic, you're going to take medications to help control blood glucose, and you're also going to take medications to prevent complications. Remember I told you most people don't die of diabetes type 2, they die of complications. So in addition to try to be eating healthy and exercising, most people with diabetes type 2 will benefit from medications. These are going to help control your blood sugar. They may help your blood pressure and keep your cholesterol in target ranges. So medications, your doctor is going to give you medications to help prevent complications. Remember I had said before, if you're a diabetic type 2, you have a higher risk of heart attack, you have a higher risk of stroke, higher risk of kidney disease and early death. And a lot of people, when they'll take their medication for their diabetes to manage their blood sugar, but they don't want to take additional medications. Well, here's the problem. You cannot wait to see what happens before you decide to take these other medications. Once diabetes complications appear, they usually can't be reversed. So let's talk about blood sugar medications. Your doctor will recommend different types of blood sugar medications based on your type of diabetes, whether you have type 1 or type 2, how well your blood sugar is controlled, and if you have any other medical conditions. Obviously, if you're a type 1 diabetic, your pancreas is not creating insulin, so insulin is going to be required throughout your life. If you're a type 1 diabetic, something that you will probably want to consider is having an insulin pump. Because if you're a type 1 diabetic, you're doing insulin injections probably 3 times a day. You know, and you get a little tired of puncturing your body with pinpricks 3 times a day. So an insulin pump has a little catheter that goes into the fatty part of, usually you put it down below your belly button, has a little pump, and that pump has a little computer on it, and you program it to give you little drops of insulin throughout the course of the day, so you're not constantly pinpricking yourself. If you're a type 2 diabetic, there are several types of pills that can be used separately or in combination to help control your blood sugar. Oral and injected insulin is also a safe and effective way for many people with type 2 diabetes. Now, medications that will prevent complications. In addition to using medication to control your blood sugar, studies have shown that certain other medications can reduce the risk of you developing diabetes complications. Because of their protective benefit, these medications are recommended even if your blood pressure is good, even if your cholesterol is in target ranges. So let's talk about what these types of medications are. Aspirin. If you have diabetes type 2, your doctor's probably going to recommend you also take low-dose aspirin, around 81 milligrams, to reduce the risk of heart attack and stroke, and that decreases the chance of a sudden blockage of an artery. ACE inhibitors, or ARBs. These are very specialized medications, and they will also control your blood pressure, but in particular, they're going to protect your kidneys. Remember, kidney disease, you're at high risk if you're a diabetic type 2, and they'll reduce your chance of having heart attack or stroke. What do? They stop the action of angiotensin. That is a hormone, and this is a hormone that's naturally released by our body, and it constricts the blood vessels. It makes them smaller. So as a diabetic, you really don't want that. So you can see on the left side of the slide is a constricted blood vessel. And when you take the ACE inhibitor, what it does is it gets the blood vessel to relax. All right. So you're probably, as a diabetic type 2, going to be on some kind of ACE inhibitor. Statins decrease inflammation in the body, and they also lower cholesterol, and that's going to reduce your chance of risk of heart attack or stroke. So reminders, if you need to take medications, you should know when to take them. Do not skip a dose. Usually you need to get a therapeutic level of the medication in your body in order for it to work. Many of these drugs are taken once a day or twice, usually before meals. And don't stop taking your medications if you don't feel well. Call your doctor. Do not stop without calling your doctor. Also, when you travel, don't pack your medications in your travel luggage. Keep them in your pocketbook or, in your shirt pocket, whatever. Keep them with you. You don't want them to get lost while you're traveling. So let's talk about how you can help prevent complications often associated with diabetes type 2. The number one thing you need to do is control your blood sugar levels. How do you control your blood sugar levels? A healthy diet, controlling your carbs between 45 to 60 carbs a meal. Regular exercise, 30 minutes every day. Taking your medications if they're prescribed, okay? Oops, what's going on here? Oh boy, what did I just do? All right. You want to maintain safe blood glucose levels. Everybody's a little different, so you want to ask your doctor what those are, but generally, Before you have a meal, including when you get up in the morning, blood sugar should be between 70 and 130 milligrams per deciliter. 2 hours after you eat, less than 180 milligrams per deciliter. If you can keep your blood sugar in these ranges, you should be okay. Blood pressure. You want your target blood pressure reading somewhere between 130 over 80 is reasonable if you have diabetes type 2. Your lower blood pressure means less stress on your heart and blood vessels, on your eyes, because blindness is a problem for people with diabetes type 2, and your kidneys. Control your blood cholesterol, and we're talking about your bad blood cholesterol, your LDL. We don't care about your total cholesterol so much. It's your LDL, and it should be less than 100. If it's not, your doctor's going to give you some medication. Protect your kidneys. You know that you're at risk for kidney disease, so you need to have regular testing and take your ACE inhibitor or your ARB medication. That's going to help lower blood pressure, and it's going to protect your kidneys. Get regular checkups. I'm sure you're doing this. So your medical exams, your A1C, remember A1C measures your blood sugar over a period of 3 months, at least once a year. I recommend more. Kidney functions tests at least once a year. Cholesterol and lipid fat tests once a year. Get your eyes examined. You want them to examine the back of your retina, because often with diabetes, you get blood vessels that grow on the back of the retina and cause blindness. I recommend every year, but minimally every 2 years. Check your feet. When you go for your regular physical with your doctor, take your shoes off. Make sure they check your feet regularly. You don't want to get ulcers on your feet that don't heal or get gangrene. So have your blood pressure checked at every visit. Get a flu shot every year. You know, as a diabetic type 2, you're going to be more prone to getting sick. Make sure you've had a pneumonia vaccination. You can have it once after the age of 65. Get your dental exam once a year. Most complications of diabetes can be prevented, they can be delayed, or they can be treated, but you have an important role. You must maintain blood sugar levels within normal range. You're going to get complications if your blood sugar is not under control. Be aware of your body and your symptoms. Report any changes early. Time is important. Make sure you get regular checkups, exams, tests, and immunizations. You need to become a good diabetes self-manager. There's a lot to learn, I know that. And sometimes putting all of this into action can be difficult. So talk to your doctor or your diabetes educator if you have one about your questions or concerns, and also consider joining a diabetes support group. You can get online and check where the local diabetes support group is in your community. It's sometimes just good to talk to other people who are dealing with the same issues that you are. And remember, begin each day, positive attitude with a grateful heart. That will help you manage your symptoms. That will help you prevent complications. And try to eat healthy. This is a delicious chicken curry salad. What's in it? I take a chicken breast, I just chop it up and parboil it in water, real easy, strain it. And then I mix it with a little bit of some red onion, some grapes, some craisins, a little bit of sliced almonds, and I make the dressing with a little mayonnaise, a little curry, and a little ginger. Mix that all together. It's delicious. Serve it on a bed of lettuce. And look at this. How many carbs? 48 grams of carbs for a good size serving. So you've got your carbs under control. If you'd like the recipe, just let Sarah know and she'll email it to you. So thank you very much for joining me today. I hope between the diabetes session 1 and session 2, you've learned a lot about how you can manage your diabetes and live a healthy life. Thank you so much. Bye-bye now.